Hepatitis is an acute infection in the liver which is caused by different type of viruses. There are at least 4 known viruses which affect the liver. These are called hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. Hepatitis A and hepatitis E are caused by contaminated food and water, whereas hepatitis B and C are usually caused by needle pricks, trauma, blood transfusion or so-called percutaneous route. That means the blood of an infected person has to come in contact with a non-infected person, blood or the blood-borne products. Hepatitis A and E are usually self-limited diseases. Hepatitis A typically occurs in children, whereas hepatitis E tends to be the commonest cause of acute viral hepatitis in adults. Fortunately, both hepatitis A and E do not lead to chronic viral infection, and we luckily have vaccination for hepatitis A, which is usually recommended for almost everybody in India below the age of 20 years. Because after the age of 20 years, most of us would have incidentally got hepatitis A, would have been protected by now. Hepatitis B and C are the infections, if they cannot be treated or cannot be taken care of in the acute phase, do lead to chronic viral infection. In adults, 5% of the hepatitis B patients in acute phase lead to chronic infection, whereas hepatitis C would almost always be chronic. Unfortunately, there is no vaccination available for hepatitis C, whereas a very good and effective vaccination is available for hepatitis B. Today only, all of us should get ourselves checked up for hepatitis B, and if we are not protected against hepatitis B, we have a very effective, safe, cheap and easy vaccine which is available practically free of side effects, so that it can be given and can give you a lifelong protection. So go and get the hepatitis B vaccination today. Hepatitis C is far more difficult to have control with vaccination, because there is no vaccination available for hepatitis C. Unfortunately, most of the patients with hepatitis C will continue to have chronic infection, and conventionally the drugs which are available were having a lot of side effects, were costly and had a prolonged therapy. But thanks to this discovery of new drugs called direct acting antiviral agents against hepatitis C, we have a plethora of new drugs which are coming into market, which will make the treatment easier, more cost effective, as well as have less side effects and will be of lesser duration. But as of now, the cost of the anti-hepatitis C viral drugs which are in the form of oral drugs is pretty exorbitant and may cost up to 1 crore rupee in one course, that is spread over a period of 3 months. But there are a lot of Indian companies which are vying for the patent for these antiviral drugs, and hopefully over the next 1 to 1.5 years we will have the availability of the oral drugs against hepatitis C, which will be equally effective as much as the conventional drugs like pegylated interferon and ribavirin. So if you are going to a dental surgeon, or if you are going to any physician or any doctor, and the doctor is not using a disposable needle, say clear no to them, because after using a reusable needle, you have a good chance of getting infected with hepatitis B and C. So dental extraction, tattooing, needle prick, trauma and pricking of the ears, all these are the potential sources of spread of hepatitis B and C infection. All of us should be vaccinated for hepatitis B, and if hepatitis B or C occurs, please go to your nearby hepatologist who can take care of this infection in the early stage, because in early stage, if we treat this infection confidently and clearly, then we can prevent the development of the cirrhosis, which if occurs will ultimately lead to development of complications like blood vomiting, black stools, jaundice, swelling in the feet, swelling in the tummy, which ultimately will require liver transplantation.